Thanks for joining us as we begin this new week and consider the challenges that lie ahead. Welcome to our members of the media and those of us who are joining us online. Today, Orange County Mayor Jerry Demings will discuss the positive cases, our goals for this week, new testing locations, and more. Dr. Raul Pino from the Florida Department of Health in Orange County is also here and will provide information on our testing numbers and other important data. A side note, our interpreters are usually here, and we made our request, but somehow our signals got crossed. They are not here today. We encourage any of those who may be joining us who are hearing impaired to please pay careful attention to the closed caption comments at the bottom of your screen. We begin to discuss our numbers now with our Orange County Mayor, Jerry Demings. Mayor?
All right. Thank you, Dr. Williamson, and thank you for all of you who came out this morning, hopefully to the men in the audience and on television. Hopefully you had a good Father's Day. I had the opportunity to spend time with my 97-plus-year-old father and my 3 sons and my grandson and my granddaughters and, of course, my wife and other family members. So it was good to just be able to spend some time with family as well. We're joined today. We have 2 of our county commissioners who have joined us, Commissioner Myra Uribe as well as Commissioner Maribel Gomez-Cordero. And so let me just get to it and just share with you kind of where we are. As you all know, this past Thursday, we told the public that we would be instituting a mandatory wearing of facial coverings within Orange County. And that order went into effect this past Saturday morning at 12:01 a.m. And it made it mandatory for anyone working, living, visiting, or doing business in Orange County to wear face coverings. I will say that over the weekend I had the opportunity to go out and do some Father's Day shopping and some other things, and I was, of course, wearing my mask. It was good to see so many people here within Orange County also who are wearing masks. We still have some who are not wearing masks, but I'm encouraged that perhaps they will. As we look at our numbers, I think that it's very important with the numbers continuing to climb rapidly. It's really important that we wear masks. Dr. Pino will share with you some very specific details about the numbers, but I want to give you just a broad overview. On Saturday, we saw an increase of 437 positive cases for the increased positivity rate within Orange County of 16.7% in that one day. That was a record, obviously, triple-digit numbers on that day, 437 cases, new cases reported in one day. Again, you all remember during the early phases of our COVID-19 response and our reporting, it took us a month or so to get up to that number. We saw 437 in one day. Yesterday, in the 24-hour period, after Saturday, we saw 345 cases, which reinforces again the necessity for the mandatory face mask order within Orange County itself. Our goal is real simple, to continue the slowing of the spread of the virus within our community. And according to the CDC guidelines, wearing a face mask is the best way to keep the coronavirus from spreading. Florida is now on track to surpass 100,000 cases this week, and we need to do our part to help slow the spread within our community. I want to go over my goals for the week. You know, each week we try to tell you what it is that we're trying to do. And first and foremost, the number one goal is to stop the spread of the virus. That is going to continue while we're in this mode. Number two is to continue with offering free testing within our community. We want individuals to know whether or not they have been infected or not. And number three, this week will remind people in all of our messaging for the necessity to wear face masks, again, for the reasons I've already discussed. And number 4, we will continue to provide CARES Act assistance to those businesses and individuals in need. So with that, let me talk a little bit about the CARES Act processes that we have in place. We have streamlined our application processes for individuals and families. This morning at 8 a.m., we opened the portals here within Orange County, and it closed at 9:06 a.m. But during that little better than 1 hour period of time, 20,000 users entered the portal. And so far today, it appears that over 11,000 applications were submitted. There are still many applications in process, so that number will grow today. The cumulative number of individual applications submitted is around 30,200. That's since we opened the portals a week or so ago. We now have cumulative applications for individual and family assistance of 30,200. Our staff will be processing these applications, and if there's still funding available, we'll open up the portal again at a future date. Now, I have some of my staff that's working behind the scenes to deal with this on a day-to-day basis. So when we get to the point, if there are any questions that you may have relative to the process, and then I'll have staff engage in that. As for CARES Act funding for businesses, a little over $9 million has been approved to process for those small businesses, those with, again, 25 employees or fewer who have applied. That process is ongoing. Businesses can apply by going to our website at ocfl.net/Orange Cares, ocfl.net, Orange Cares. That is an ongoing process, unlike the process for individuals and families. We open it and shut it down. With businesses, that's an ongoing process. Orange County Health Services is focusing free testing in more of the zip codes where we see significant numbers of new cases. They are in the Apopka and Zellwood areas this week. Today, the team is at the Farm Worker Association of Florida in the Apopka area. Tomorrow, they will be testing at the John Bridges Community Center in Apopka. And on Wednesday through Thursday, they will be at neighborhood centers for families in the Zellwood location. In addition, coronavirus testing will be done at the Legacy Middle School on Lake Underhill, and that opens today and will run through Thursday. All appointments are already booked for today and tomorrow at those locations. Then we have test sites where appointments are needed. You can go to our website at ocfl.net/coronavirus to register for testing. On our COVID testing webpage, we also are sharing information about one of our local healthcare providers, True Health, is doing testing as well. You can see information about their test sites. True Health is one of Orange County's primary care access network partners. Site testing is available in the Lake Underhill area, South Orlando, and the Alafell Trail areas. We are committed to also ensuring that we have adequate personal protective equipment that are supplies that are being distributed within our community. And so we will be increasing distributions to small businesses for the PPE Wednesday through Friday of this week. Orange County plans to serve as many as 10,000 small businesses and plans to distribute an additional 2 million face masks and 200,000 travel-sized bottles of hand sanitizer. More than 3,000 small businesses have already signed up to pick up the PPE kits. Each, again, contains the face mask and hand sanitizers. You can make appointments at our website if you're a small business, 40 or less for the PPE distributions. If you have 40 or fewer employees, then you qualify as a small business and you're able to register to receive the PPE at the various distribution sites. And that, again, is on our website at ocfl.net/PPE. And so with that, I'm going to turn it over to Dr. Pino for an update on the health related numbers that we see in our community, and then we'll open it up for some questions at that time. Again, if there's any questions by the Spanish-speaking media, feel free to ask your questions. We will jump in and try to answer your questions at that time. Thank you.
Thank you, Mayor. Before I give you the numbers, I want to remind everyone that we continue to do vaccinations for our kids that are going into 7th grade. That's an important vaccine that they are going to receive and they need before they go into 7th grade. So if you have a child going into 7th grade, and you have received an email from the schools indicating that please call 407-723-5005, press number 2, and they can give you an appointment to take your child for vaccinations. Did I say the number wrong? What was that? 50004. Again, I'm going to say the number right. 407-723-5004, press number 2, and we will give you an appointment. We have vaccinated already over 1,000 kids during these 3 weeks. And we want to prevent any outbreaks within an outbreak. So we will be insisting on flu vaccinations for this fall. I also want to call your attention on multi-generational living. We have a few cases that is clearly individuals who are living home with extended families that are 65 years or older, and it looks like other people are coming in and out into the community. We should wash our hands, and as I said before, these people should be protected and masked even when they are home if they are not doing anything else that don't need a mask to have it on. Please continue to practice social distancing. Wearing the mask is mandatory now, and remain isolated if you think that you may have been in touch with the positive cases and need to be tested. Also, we have increased our workforce at the health department. I want to thank about 30 individuals that work all over the weekend, the entire weekend, because we have an objective right now to give everyone a call the same day that we get the result. That will not be the trace investigation. That will be an initial call to educate the individual about staying home, what to do, how to protect himself, how to protect others, and who should be getting tested while we get into the trace investigation in more details. With that, I would like to let you know also that we have up to today, the numbers are going to differ a little bit from the data because we are here earlier than normally, so the data is getting cleaned up as we speak. But the numbers that have been provided by my department are 5,157 cases. Now, it could be a little bit of a difference there because the data is getting clean, as I said. Our overall positivity rate is about 4.5, and our recovery rate has gone down to 55. Remember that at some point we have it in the 80s. We have tested over 100,000 people, and we have a 49th death. Now, with this one, it could change. We are having conversations with the state. This is an individual, unfortunately, 24-year-old, who was positive but died in a motorcycle accident. Our prayers and thought really with his family. But we don't know yet. It would be in the final count as the cause of death was other than COVID-19 itself. But that's for the medical examiner to determine. But the case is there. We will provide more information when it comes available. Also yesterday, we received 1,631 negative tests. We received 210 positive tests for 11.4%. The day before that, Saturday, we received 2,216 cases, 437 positive for a 16.5%. The data in hospitalizations, visits to ER for fever, cough, and children of birth has increased slightly for our county, and the visits to ER has dramatically increased itself for what we call flu-like symptoms and influenza-like symptoms and COVID-like symptoms. Also interesting, in the last 14 days, our median age is 29, and 43% of all our cases in the last 2 weeks are in people between 20 and 29 years old. So that gives you an indication of how active the pandemic it is within the younger segment of the population, and the country in general is experiencing the same thing. For hospitalization, how do we compare to the state? The state has a 13.8% of hospitalization cases. We are 14.5%, so we hospitalize a little bit more than the state. Our healthcare workers are about 9% of all total cases. For the state, is a little bit higher, about 10.8%. Our case fatality rate, it is 0.98. For the state, is 3.34. It's much better for us. And the median age for us in the last 14 days is 29. For the state, is 35. I also would like to recognize the work that the airport has done and the airport authority. As you may have remembered, we have a few cases coming out of different outbreaks on the airport from different times during this period. Since about 3 weeks ago, there was an executive order masking the airport, and also the airport has taken extraordinary measures, and I'm extremely happy to say that that has died out. That we basically have no cases coming out of the multiple outbreaks, and I want to thank the airport and the personnel and the executive authority for taking the steps that they have taken. And also with regard to an outbreak that I mentioned to you last week, that we were very concerned in an assisted living facility where we have 22 cases, 17 residents, 5 employees, and that's the one that I described for the steps that we took last week. We are doing a second round of testing today. We will see what those results are. But during the week, the place has performed very well, and the administration and ownership of the place has been very cooperative with us in all the steps that we have taken. With us, Mayor?
All right, thank you, Dr. Pino. At this time, we will open it up for any questions that you may have from the media. There's a mic moving around, so
Sorry about that.
If you can just wait on the mic to get to you. Okay.
Mayor Demings, Greg Fox, Wesh TV. Can you tell us what your thoughts are on the lawsuit that was filed yesterday opposing your executive order on a number of grounds, among them that a number of government and first responders are not required to wear masks?
I haven't seen the lawsuit, so at some point the county attorney will brief me on that. But let me just say this. We don't customarily respond or reply to questions related to lawsuits when we have pending litigation. But suffice it to say that I still believe that what we're doing is a measured approach in this community to responding appropriately to the current state of affairs regarding the COVID-19 virus that is raging amongst us. Okay.
Mayor Demings, good morning. Greg Angel with News 13. We've been hearing some concerns from some theme park workers about some potential positive cases in some of the theme parks among workers right now. What is the county's oversight with the theme parks right now? And overall, what should Orange County residents take out of the new data points this morning? So kind of a two-part question there.
The Department of Health gets to look behind the curtain at the current new cases that we see within the county, and I'll let Dr. Pino kind of respond from the health response to that. I have not been made aware of any disproportionate numbers coming out of the theme parks per se. Regardless of the work locations, wherever that work location is, it's a microcosm of the society at large. And so if we have the virus in our community, if you have any work location of any significant size, you're going to have positive cases of employees working at those work locations. But much about what we have to do is, how do you respond to it? What are you doing to make certain that your employees are as safe as they can be while at work, as well as the visitors or the patrons of those locations? Here within Orange County government, we have an abundance of things that we have put in place to try to screen individuals who still have to interact with us because of the public service that we provide. We're going to continue to do that, from mandating the wearing of masks by employees to making masks available for our visitors, to the hand sanitizer locations, to the social distancing. You can see visible evidence of that when you come into this building. And I believe that's what you see when you go to our respective theme parks. We are all learning to live with the virus in our community to the best that we can. And so when everyone does their part to make us safer through adhering to the CDC guidelines, then that is just what occurs. We become safer as a result of it. So, long way to answer your question, but I want to be fair about the expectations that people may have as well. Dr. Pino.
So we, last week here, anecdotally about some cases from the park, we did search our databases. Last week, I had no evidence of any cluster at any of the parks that are opened. But remember also that places like Disney Spring or Universal City Walk, and that was the places that we were getting some complaints from, are multiple ownerships, and they lease the space. So it's a little bit complicated to say those are Universal cases or those are Disney cases when you have those multiple locations. But again, we search. Of course, it's self-disclosed. So it could be that someone may have not disclosed that they work at Universal. That's possible. But we researched the databases and couldn't find any evidence of any clusters. That's not to say that it could happen tomorrow or another day.
Mayor, if I could be in Spanish, the answer somebody can maybe translate. Who is supposed to enforce the use of masks? At this point, since there's no fine, is that the authorities or somebody can come, the owners of the business? And also I have another question. If you see any clusters of the virus in places where it's a concentration of farm workers, like people who work on the farms, as suggested by the governor, that those places were a source of the spreading.
Okay, so we'll respond two parts. We'll talk about the enforcement and then whether or not we see a higher incidence of farm workers. I'll take the first part and then I'll ask Dr. Pino to take the second part. Did you want it in Spanish? Okay. So you're going to interpret what I just said in Spanish? Sure. Okay, you got it. All right. So in terms of the enforcement, we were intentional in not making it punitive at this point.
Con relación a la aplicación de la ley y hacerla cumplir, hemos sido intencionales en no imponer penalidades.
So today there are no fines or criminal sanctions associated with a violation of the mandatory order.
Hasta la fecha no hay penalidades o cargos criminales por violaciones a la orden de utilizar mascarillas.
However, that does not mean there is not enforcement.
Ciertamente eso no significa que no exista la exigencia de cumplir con la ley.
Because when we see complaints, we have a number of options to respond to the complaints.
Cuando vemos quejas, tenemos varias opciones de responder a esas quejas de no cumplimiento con las mascarillas.
We can respond by working with the Department of Health to have staff respond to a location where there are violations.
Podemos responder a través de colaboraciones con el Departamento de Salud para aquellos comercios donde se reporten no hay violaciones.
And the goal there is to try to get compliance to work with the business to remove the violations.
En esos casos, la meta es trabajar con el comercio para conseguir el cumplimiento.
Some of said businesses are also regulated by the Florida Department of Business and Professional Regulations.
Algunos de esos negocios están regulados por el Departamento de Profesiones y Regulaciones del Departamento del Estado de Florida.
And if they are not following the CDC guidelines,
Si no están en cumplimiento con las directrices del CDC,
the state has regulatory authority over licensed businesses.
el Estado tiene autoridad regulatoria sobre esos negocios que están autorizados por el Estado.
So if there is continuous non-compliance, perhaps under state law, there could be an impact on the licensure of said businesses.
Si no hay cumplimiento, el Estado pudiera tener un impacto sobre la licencia de ese comercio.
And lastly, we're asking everyone to help enforce it. I do see that happening where a bit of peer pressure is taking effect.
Finalmente, le pedimos a todos que nos ayuden a cumplir con esta orden y que ejerzan de cierta manera presión, efecto de presión de grupo.
Because patrons will not patronize businesses that don't adhere to the directives.
Los clientes no patrocinarán aquellos negocios que no estén haciendo cumplir las órdenes.
So the best influence is in the pockets of the businesses. And we all control that.
La mejor influencia está en el bolsillo de nuestros negocios y tenemos nosotros un rol en ese aspecto.
And now we'll ask Dr. Pino to respond to the question regarding the farm workers.
So with regard to this mask as well, I think making it mandatory is the first piece of enforcement. And it is important because it gives people the ability to demand from businesses and places of work that is a mandate. I will do it in Spanish, but I also have to do English. Entonces, lo que estaba diciendo es que la orden, para empezar, la orden por sí sola es una pieza de protección y de refuerzo de la idea de que debemos usar la máscara, porque le da a la gente también la habilidad de en esos lugares de trabajo y en los lugares de negocio de demandar que se use la máscara, porque es mandatorio en estos momentos. Esa es la parte. Yo creo que no podemos estar en todos los lugares a todo el momento diciendo a la gente ponte esta máscara. Le hemos dado condones a todo el mundo de por vida y todavía tenemos enfermedades de transmisión sexual. El asunto es que la persona tiene que tener la responsabilidad de tomar esa decisión para protegerse él y para proteger a los demás. Ponerse una máscara es también un elemento de protección y respeto por la vida de otros. The other part that I added is that putting a mask on it is also a way to protect yourself, but also express respect for the life of others that you may be placing at risk. With regard to the farm workers, yeah, there have been some outbreaks in farms. It's a place of employment like any other place. And the place that we had in Apaka, we have excellent collaboration from the farm. And that was an outbreak that we were able to kill right away. So that's important. Are we having spread community distribution like the mayor spoke about it? Yes. What it makes farm workers particularly interesting is that many of them may be undocumented, and people who are undocumented normally have the fear to get in touch with government and institutions for the known reasons. And so it could be that many of them are not seeking care because they are afraid of that. And nothing farther from the truth. From the health department perspective, we are open to everyone. We don't ask for any information. It's not our objective to learn if you are here documented or undocumented. It's our objective to protect you and protect the community at large. Lo que dije en inglés fue que sí hemos visto algunos outbreaks en trabajadores de granjas y de la agricultura, pero no creo que tengamos un problema en este tipo de trabajadores. Pero en los lugares donde ha habido esto, tuvimos una situación en Apaca y nos fue muy bien y la granja colaboró eficientemente con nosotros para hacerle la prueba a todo el mundo. Hicimos más de 300 pruebas en ese lugar en un par de días y determinamos quién estaba positivo. Hicimos lo que teníamos que hacer. Pero no creo que haya evidencia de que en particular los farm workers nos estén dando la mayoría de los casos. El asunto está en que muchos de los farm workers que pensamos son personas indocumentadas y pueden tener el temor de entrar en contacto con el gobierno, pero nada más lejos de la verdad. Nosotros, el único objetivo que tenemos es de protegerlos a ellos y de proteger a la comunidad. Si usted está indocumentado, usted se puede hacer una prueba en cualquiera de nuestros sitios, no va a haber consecuencias desde el punto de vista de inmigración. Gracias.
Dr. Pino, this question's for you too. Lauren Seabrook, Channel 9. Last week you told us about some of the outbreaks that were coming out of the bar scene. You've talked about the multi-generational living situations. What other situations are you seeing some of these large numbers come out of, or is it that it is mostly just those two? My question is really for people who maybe don't have that kind of a living situation or are not planning on going out to the bars. Is there concern for going to the grocery store above what we've normally seen throughout this pandemic?
No, we haven't seen any. The most important change in the pandemic has been that it's going younger. That's the change for us here in Orange. And I heard in the news and other places that it's happening all over the place. But for us, it has gone dramatically younger. So I have hopes that this is going to be an increased number due to the social activity in the younger population that we saw 3 weeks ago, and then we could go back to where we were before. And that's why it's so important to continue to use masks, to wash your hands, to keep your hands away from your face, and to be mindful that people over 65 years old with pre-existing condition have a very, very, very high risk. And the risk gets higher if you get hospitalized, and it gets even higher if you go into an intensive care unit. And those are the steps that we want to prevent. Because if it's here in the younger population and we don't take the steps that we need to take, it will jump into the older population at some point, inevitably.
Nadine with News 6. You had mentioned that you guys are going to increase employees, or you're hiring more folks, or how does that work in response to talking to individuals who test positive? And even further than that, if there are businesses where you received complaints, is that where the staffing will come from? And did we have any complaints this weekend?
Ooh, those.
Sorry.
It's one question per person.
I know, but I got them all in.
So the hiring. So with support from the county, and we are in the process of making the determination to hire 20 additional individuals that will be trained at the health department here at Central in our building And we will establish a tracking center in our offices over here. I am also in initial conversations with a company but it's very, very initial conversations where we could use electronic means to increase our ability to track individuals. And that has been used in Monroe County in New York and also in Arizona, in Phoenix, and with positive results. So I'm monitoring, and see where that goes. But also what I was referring initially was diverting people from other activities from the health department to track investigation. We have the capacity to increase our numbers within ourselves as needed, but of course that takes a toll in other activities that we normally will do, and I cannot force people to work 7 days a week. So it creates issues with rotation, unions, labor, and others, but we have about close to 40 people that work all over the weekend, even from home, using other technological tools to be able to reach those individuals.
Steve Hudak from the Orlando Sentinel. Mr. Mayor, the mayor of Miami has said that he's going to make public now, daily, or at least on a regular basis, the number of patients, COVID-19 patients who are hospitalized. The state doesn't require that. Seminole County does. Will you do that? Because it seems to be, it's one of those things that helps us understand the gravity of the case, of the matter.
Regarding that, we're somewhat at the mercy of the State Department of Health, the Surgeon General. They are the keepers of that information. Currently, the hospitals are required to report daily to the state on the numbers. We have no mandate locally for them to do that, but it is something that is a fair question. I do get briefed on a daily basis by Dr. Pino here at Orange County, who has opportunity to look within the dashboard that the state has to report those numbers. And so it is a number that we're tracking, and one that is going to become increasingly more important for us to track. I've said before that there's two primary drivers for me in terms of making public policy, one of which is the day-over-day positivity rate. The second is the capacity of our hospitals. And hospitalization is reflected of the current capacity within our hospitals, and so that's something that I look at. I hear what you're saying. You want it to be made public, and so we'll endeavor to do that.
Robert Guadarrama, Fox 35. Mayor, two questions for you. One, it appears in the last week we've seen a shift in tone and mixed messaging coming from the federal and state level as far as the severity of COVID-19. As the leader of Orange County, what is your message to the citizens as far as how serious they need to take this most recent spike? Second question, on social media, we're getting a lot of questions about why you're not wearing a mask right now, if you can respond to that.
Okay, so take the first last. When I'm here doing the briefings, I come in with my mask, I leave with my mask. But when I'm communicating to the public, I want them to see my facial expressions. Some people who are watching are actually reading my lips. And so they have communicated with me that they want to be able to clearly understand what it is that I'm saying. So that's why on that. In terms of the apparent contradiction sometimes between what we hear from the federal level or the state level versus the local level, some of that is just plain old politically motivated. But for me, the decisions that we're making here at the local level are apolitical. It has nothing to do with one's party affiliation. It has more to do with putting the needs of the people first and not the politics of the people. So here in Orange County, you won't see me make any decisions. It is irrelevant to me about what political party you're in. I care more about your personal safety and I'm concerned about that. Because when you look at these numbers of new cases, nobody is identified as being in any political party. When you look at the deaths, they are not identified as being in any political party. But because we're in this political season, this response to COVID-19 has become politicized. But you have never heard me say here anything about the politics associated with it. And so I would just tell you that for the citizens of Orange County, I think it's in their best interest to not be persuaded by anyone who will put their personal safety at jeopardy because of the political expediency of what that means to a political party. Yeah.
Hello, Alibet Suárez para Más 100.7 FM. Mi pregunta es para Dr. Pino. Muchas personas en este momento ven con preocupación la llegada del fenómeno de la columna de arena del Sahara. Mi pregunta sería si esto puede elevar los casos de contagio del COVID, ya que, bueno, agrava las condiciones de los pacientes con problemas respiratorios. ¿Cuáles son sus recomendaciones? Y además esto implicaría que serían más operativos de entregas de máscaras en general para la comunidad en general.
¿Puedes decirme qué dijiste que era la causa?
El fenómeno de la llegada del polvo de Sahara.
Oh, ok. Pues mira, las alergias. Ahora que estamos saliendo de la primavera, entrando en el verano y después en el otoño, las alergias siempre van a estar presentes. Y son algunas veces hacerse la prueba es lo que pasa y la gente va a los a los salones de emergencia. Y no debe ser el lugar al que vamos para cuestiones que no sean serias, porque es un lugar donde vamos a encontrar un número de casos y no queremos que la gente se contagie innecesariamente. Desde ese punto de vista, pues hablar con tu médico primario es el mejor consejo que se le puede dar a cualquiera. The question in Spanish was if I see an issue with increasing of the pollen in the air during this season for asthmatic and other people with respiratory issues, and what would be the advice? And the advice was always consult with your primary provider and not to go to the ER if you don't absolutely need to.
Jean-Pierre Radio Haiti, question for Dr. Pino. Taking into consideration the fears of COVID-19, what do you have to say to the parents who have to take their kids for vaccination?
For vaccination for?
Yeah, school vaccinations.
School vaccinations.
Yes.
So, I mentioned before, we don't want to have a pandemic in a pandemic on top of it. So measles is one that comes always and is always lurking in the background and ready to jump because it's very infectious like this one and it goes wild like this in an environment. The important part about people immunized for any disease, so that people understand this, is what we call immunity of the herd. And it's basically, someone can get infected, but if a large percentage of people are immunized, the virus or the bacteria or whatever the germ is may not be able to jump too many nodes, too many individuals, because it's going to find someone that is vaccinated and it's stopped right there. And that's what you try to do when you are vaccinating people. It's not only to protect the individual, but it's also to protect the community, because those individuals that are vaccinated are a barrier against the germs, and also to protect those who cannot be vaccinated because of allergies and other situations. So that's why it's so important to have vaccination rates at least of 70% or higher, although we thrive for about 95% in some vaccines.
Okay, I have a couple of questions for Dr. Pino. This one coming from WFTV, Alexa Lorenzo. She's asking, what role does the antiviral medication that's being tested as a specific treatment for COVID-19 played in the increase in hospitalizations?
So I don't have the data. Anecdotally, some of the providers have said that sometimes they have to, the patients stay a little bit longer in the hospital, depending on which of the two treatments that they have with the antiviral medication place. But I don't have that data. That's a data that probably we're good to have. But I can say is that we are holding the stockpile for Region 5 and Region 4, I believe. So we are distributing those vaccines, those antiviral therapy, and we got additional from the state. So for those providers and the hospitals, remdesivir we have for our patients.
The second question, Dr. Pino, is coming from Eric Sandoval with Channel 6. Over the weekend, several bars announced online that they were temporarily closing because of their workers were diagnosed with COVID as positive. Can you talk about the concerns you might have with the virus spreading at these locations?
So the bars are coming up as a place where a lot of transmission is occurring. I cannot deny that. That is on the data. To one of the bars surrounding UCF, we were able right now, and this is as a Friday that I was briefed on it, so it could be higher today. We have linked 152 cases to that specific location. If the reports in the newspaper are correct, that's about 50% of the people that entered that bar. So a lot of transmission happened there. It's a very close environment. They are normally small. People are very close. People were not wearing masks. And people are drinking, showering, dancing, sweating, kissing, hugging, all the things that happen in a bar. And all the things that happen are not good for COVID-19. So it's very simple.
Okay. And next, Mayor Demings, this question is coming from Ryan Lynch with the Orlando Business Journal. The Orange County Economic Recovery Task Force is meeting this Wednesday. How might they fit into decision-making with the rise in local cases?
We had instituted the Orange County Economic Recovery Task Force to be an advisory group to me as we make public policy. And they will be updated with the medical, the health information that Dr. Pino has shared here. And we also have the experience of several businesses that have recently reopened. And so there'll be a spirited dialogue, I believe, of the Economic Recovery Task Force, who will then in turn make recommendations going forward about the future. There were supposed to be 4 phases of reopening, and technically we're in phase 2. We had phase 1, and then we had the full phase 1, and then phase 2. Suffice it to say, with the recent uptick in the number of new cases, it is unlikely that the projected time period that we would have gone to phase 3 has been delayed. And I believe that, again, is something that is controlled primarily by the governor and the state of Florida that impacts all of the other political subdivisions of the state. And so we will certainly be impacted by that. None of us want to open too quickly and adversely impact the spread of the virus in our community. So it'll be a measured approach. So I look forward to having a dialogue with the Orange County Economic Recovery Task Force this week. Okay, with that, we're going to conclude the press conference, and thank you all for being here. Hopefully this has been informative to you. We'll come back and update you again within just a couple of days or so of where we are within this community. If there's a desire for one-on-ones, certainly they're here, whether that's the Spanish-speaking media or otherwise. We're here to do that. Thank you for being here.